I'm Dr. Joshua Alexander, Chair for the UNC Department of Physical Medicine Rehabilitation. I'm here at our Hillsborough campus, about 15 minutes north of Chapel Hill, where construction has already begun on a 4-story tower that will be the home of our new state-of-the-art inpatient rehabilitation center. This new center will enable our department to continue to grow our inpatient programs while adding cutting-edge technology and innovative services like virtual and augmented reality therapy, a center for complementary and alternative therapies serving the patients throughout the hospital, and a rehab makerspace where 3D printers can make custom-made splints, braces, and other devices for our patients. As a resident, you'll not only get the chance to learn from and care for patients in this beautiful setting, but you'll also be able to experience and participate in cutting-edge therapies and research during your training. And this new inpatient center is just one way that our department is continuing its rapid growth. Just over the past few years, we brought in great new faculty in spinal cord injury, spine, stroke, pediatrics, MSK, and more, enabling us to add new clinical and research programs to a service-oriented department filled with wonderful people who use their creativity, expertise, and energy to improve the health, function, and well-being of patients who come to us from across our state and region.
We have a really collegial environment, I think, amongst the residents, amongst the faculty, and so we want people that function as team players who are willing to help each other out, monitor each other's well-being, and support each other when they need it.
Dr. Alexander has done a great job making this department have a family feel, and that really has drawn me here, and I think that's what draws a lot of the faculty here too.
I started off with general medicine, which is one of the harder rotations just because of the pace. You work 6 days a week and it's just very new and you need to adapt very fast. My senior on the team invited me and the other intern who was going to start the night before we started, and she walked us through pretty much what a day looks like. It was so comforting because, you know, she brought us into her home without knowing us, fed us, and just sat and calmed us down and removed a lot of the anxieties of, you know, first day jitters of going in. She was so open to questions, and that's what I loved here.
You know, every attending I've worked with has been dedicated. From the day I stepped on as an intern, you know, not working on the rehab service, on the general medicine service, we consulted PM&R, and one of the attendings came down and said, you're one of ours. I know you. You know, I've seen your picture around. What's going on with this patient? Tell me about him. Which just really involved us in kind of the rehab aspect from the first year. Me and my co-residents have been kind of, even through intern year, hanging out pretty much all the time. It makes the day go by so much faster when there are people you like and enjoy to talk to.
During residency and during life, you have challenges. I've had challenges during residency, and I have had so much support from my program, but also the ancillary staff. The therapy team just threw me a baby shower, and just everybody is so thoughtful, everybody's so kind and genuine, and people love each other. It's just such a supportive place to be.
During my rotations, I had a few physicians that were attending on rotations. It was like one OBGYN attending and then one internal medicine attending said, you have to apply to UNC. Just give it a shot. Because I was very set on, I'm staying in New York, my family's here. Because of their advice and kind of their push, and I heard it multiple times to say you need to just see the culture of UNC. I applied and was immediately won over. Everyone was so kind, and I think that was the biggest thing that won me over. You feel like family the moment you step foot on campus and you meet the whole team, and it completely changed the trajectory of what I wanted to do and where I wanted to train.
UNC PM&R is a well-established, yet constantly evolving program in a highly educated and wonderfully diverse and supportive college town that's located in a truly beautiful part of the country.
We're really interested in recruiting people here that have a strong commitment, who are curious and driven and not afraid to problem solve and really be creative in how they address the needs of the patients that they're seeing.
One of the reasons I love being a part of the UNC Department of PM&R is that we prioritize both excellence and inclusion. Commitment to this ideal manifests itself in our resident didactic curriculum, which delivers not only a rigorous clinical education, but also helps residents understand how disparities in access to care influence health outcomes. Our resident lecture series includes structural competency training that helps learners identify and address barriers to delivering the highest quality care for all patients. We also host regular department-wide forums that give faculty, residents, and staff the opportunity to improve health access and resources for patients who are living with disabilities. patients who are often vulnerable and underserved. As a PM&R department, we strive to leverage our expertise as rehabilitation specialists to help our diverse population of patients adapt to and overcome functional impairments to the best of our ability. This is a department that is welcoming and supportive to all its team members and invested in mitigating health disparities by giving every patient access to the very best care.
Thanks again for your interest in our program. We look forward to meeting you, learning how we can help you grow into the person and professional that you're meant to become.